with our panelists in just a second. You guys are in for a treat. All right, Eagles, we are ready to get started. I am Ashley Rhodes Watkins, Student Life Coordinator at the Northeast College, and I am going to pass it over to Ms. Chardee Campbell, who is going to be moderating our panelists today and to introduce them. So, Ms. Chardee, I'm going to hand it over to you.
Yes, thank you, Ashley. I thought you were going to announce what was on the screen. But I do, before we get things kicked off, Ashley, if you could bring it back up on the screen, or whoever was sharing, I'm not sure if it was Ashley or Dominique, but welcome to the Black History Program, Racism as a Public Health Threat. We are going to be diving into this topic, but before we do, I wanted to point out what else Student Life has going on. The most exciting of which is something the first time we've been doing is a video contest as a part of the programming. So we want to know why it's important to celebrate Black History Month. How are you commemorating Black History Month with a 30 to 45-second video? The top 10 videos will receive a $100 gift card. So this is really exciting. It's going on the entire month of February. I will bring this back up at the end of the event, but take a screenshot, consider submitting it. It doesn't need to be high production or anything like that. We want to hear the message. We want to amplify why it is so important to continue to be intentional, to commemorate and reflect during Black History Month. So if you aren't going to do it, don't be stingy, tell a friend. And I just wanted to make sure we do that. Also, Student Life sends out an email typically every Monday with all of the events that they have coming for the week. So you will see all of the remaining Black History Month events. So be sure to check your email. There are text messages that you can sign up for. And just, celebrate these 28 days that we have. So we have so many events that are going on, and I know there's a line dancing class tonight as well. So celebration continues. I want to kick things off for this particular event as the Student Life coordinators drop the links in the chat. My name is Chardee Campbell. I am the Enrollment Communications Officer, Manager here at Houston Community College, as well as a resource specialist for the African American Resource Group for employees here at Houston Community College. It is my pleasure to serve as a moderator on this panel today. I will introduce the person sitting next to me as we introduce the rest of the panel, but I wanted to kick off with some initial context about what we are going to be talking about today. I'd like to again thank our Student Life coordinators, Dominique Brown and Ashley Rhodes, who made this event possible. And at HCC, our goal is to put the community in community college. And that means as an institution, we recognize our obligation to create diverse programming and opportunities for reflection and connection. Today's conversation is an important one, but it can also be difficult and heavy for some. I encourage you to lean in and listen to all perspectives, and most of all, be open. Be open to learn and unlearn. Many may not know that there have been over 170 declarations of racism as a public health crisis that have been adopted since 2019. That includes 4 states, 97 cities, 69 counties, all implemented by governors, mayors, county executives, city and town councils, the Board of Health and School Districts. The CDC became the largest US-based health agency to single out racism as having a profound and negative impact on communities of color and contributing to disproportionate mortality rates among people of color. When the declarations of racism as a public health crisis, what it does is what a great urban philosopher and an internet auntie, Ayanna Van Zet, refers to calling a thing a thing. We can't solve what we refuse to name. And that is the importance of a first step of naming racism what it is. The structural barriers of racism that impact racial and ethnic groups differently influence where a person lives and whether they're exposed to different levels of pollutants, where they work, and if they're under or unemployed, where their children play and go to school, and how they can access healthcare, and where they worship and gather in the community. Today, the panel will take a look at how systematic racism specifically affects African Americans, health outcomes, and why systematic racism should be treated as a public health threat. I'd like to introduce our panel. Joining us today is first up, Tammie Campbell sitting to my right. And if you all cannot tell by the last name, you should be able to tell that I stole her face. This is my mama. But she is more than a mama. She's an award-winning activist, founder and executive director of the Honey Brown Hope Foundation, a national NAACP Image Award winner for her community service, the former NAACP State Education Chair, and the first female president of Missouri City NAACP. Joining us as well is Dr. Joye Carter. She was the first African American to be appointed as a chief medical examiner in the United States. She's a veteran. She was Houston's first Black medical examiner, and she was the independent medical examiner on Sandra Bland's case. In short, she's a bad chick, okay?
Oh, yes.
We also have Dr. Chastity Holliman Douglas. She is the Associate Vice Chancellor for Special Programs and Success here at Houston Community College. She is a diversity, equity, and inclusion professional with a strong record of achievement in advocating for students and developing initiatives to eliminate equity gaps. She's a bad chick too.
Oh, yes.
But we had to round this out. Had to make sure our brothers were represented. And we are pleased to have on this panel the Young Invicibles Engagement Manager. Young Invicibles is a powerful advocacy organization. Greg is also a graduate of Houston Community College and a former student leader from Central Student Government Association. We have a dynamic panel ranging between different areas of activism, ranging between different professions and intergenerational. So you're going to hear a lot of perspectives as we jump into this conversation. Feel free to drop those questions in the chats. Look, drop questions, drop comments, drop affirmations, wherever the spirit leads you, as long as it's respectful, okay? We're gonna have a Q&A towards the end, so we will be taking a look at those questions as we go, so don't think that we aren't checking those out, so continue to drop those. To kind of center us in this conversation, I'd like to kick off with Dr. Joye Carter around systematic racism effects on Black bodies. Dr. Carter, as a medical examiner who sees the final state of bodies, will you please share how the stressors of systematic racism could affect organs in the body?
Well, good afternoon, everybody. I'm going to start from a different point from the very beginning. Imagine going to the hospital to have a baby, and the nurse doesn't think the baby is yours because the color isn't just like yours. Can you imagine starting life off like that? The stress the mother and father feel because somebody is ignorant of all the different hues that we as people of color come in. That continues all throughout life. If we teach that Black people, particularly Black people and other people of color, are not the same as white people, we have the stress of racism throughout our lives. Now I go to the other spectrum. We are teaching, unfortunately, and we are showing that Black people don't have the same pain sensitivity. So therefore, if something happens in a physical encounter with police, they're going to be tased more. They're going to be shot more. They're going to be held down more. They're going to be punched and beaten because there's some thought that there's not the same pain sensitivity. And I can tell you, I've taken over 20,000 bodies apart. There's no difference in the organs. If you have a disease, it affects us as human beings. We have to continue to teach that. So from the cradle to the grave, if we don't start looking at people as people, if we don't get rid of the designation of race versus ethnicity from our federal government down to local, we're still going to be in this cycle of public health disadvantage.
Well, kick us off, why don't you? Okay. And one of the things that I did want to, even if there's anything else you want to expound on, dating back to slavery, there have been false ideas about Black bodies and our tolerance to pain, to performing procedures on us without any type of anesthetic. How just knowing that we've been wrestling with this for 400 years, is there anything else you could share about how these false ideas about Black bodies impact African Americans' experience with the healthcare system?
Oh, absolutely. And I was literally just talking about that the other day. We have got to go back and unlearn false history and learn real history. There's no excuse anymore. We are human beings. You know, I don't like being segregated by my skin color and not being considered as a human being. So when someone says race, I think they mean the Indianapolis 500, because there's one race. We are part of the human race. And so we have all the stress of not being considered human all the way, or 3/5 of a man, or what I say, 4/5 of a woman. We have to ourselves stand up and say, wait a minute, we are people. And we have been treated so differently. Can you imagine being paid by the Southern plantation owners to measure the volume of a person's skull? That was one of the things that was held in the Philadelphia History Museum. All of these skulls that were gathered of former slaves and marbles put in to show that there was a difference in volume, except it didn't. Can you imagine being paid by the federal government to show that people of color did not have the mental capacity to be supervisors instead of just field hands, to be managers instead of just workers, to be patients without sensitivity instead of doctors and nurses, and certainly not able to understand, read, or write the human language? We've been bearing all of this time. And whenever somebody becomes the first, it's such a shock. But the fact of the matter is, we would have been the first if you had not prevented us. So there's a lot of history that goes along with that. And that's one of the reasons we have a problem with people even accepting some of these vaccinations that are needed today to live healthy lives. We still remember in our psyche what our grandparents passed down to us, the way we were treated, the last to have access to health care, the first to be experimented on, the first to be considered, you can go back to work, or you can go back on that football field with just a little bit of pain medication. So we have all these generations of things that affect us and lead to our stress and ultimately shorten our lifespan.
Thank you, Dr. Carter. Part of this and what you've highlighted is around us not looking intently at the history, and also looking at history as isolated incidents and not patterns. So I want to shift gears and go to those kind of in the heart of activism about how would, and we'll start off with you, Mama Campbell, and go to Greg. How would you explain systematic racism to someone who looks at racism through the lens of isolated incidents?
Well, first, I would like to thank you and Ashley, along with Dominique, for being forerunners and getting out the truth and teaching the truth and letting our students at HCC be able to critically think about what has transpired and what is going on. So I appreciate that. And I appreciate each and every one of my colleagues here today, my dear friend, Dr. Joye Carter, Dr. Chassity, and Greg. Thank you for joining us, and to the students. Now to your question, Chardee. How would I explain systemic racism to someone who looks at racism through the lens of isolated incidents? I would take them on a trip, on a historical trip, and show them how it is written in our American fabric, in our Constitution, how it has continued from slavery to the civil rights, through the civil rights movement and current events. I would have the tourists to take the trip, looking through the eyes of an African-American child who grows up experiencing these incidents over and over again of racism. Then I would fast forward and I would present present day issues to show how the same storyline, different time, but the same storyline, different times, racism has affected and are affecting our people today. Now, on this trip, the participants would be treated like second-class citizens. They wouldn't be treated like ordinary citizens. So they could understand that racism is not a single incident to be handled in the lens of looking through the lens of a single incident. Then as we fast forward, I would have them to still see how racism is plaguing African Americans, from seeing the life being squeezed out of George Floyd to the protests over the death of Breonna Taylor and Ahmaud Arbery. All of this is debilitating. Now, on this trip, the participants would be treated, as I said, like second-class citizens. So they wouldn't be able to, experience the real truth about how this scenario continues to happen. And upon conclusion of the trip, I would then ask the participant to share how they see racism and if they view it from a single incident, where I would only allow them to give me one incident of all the things that I taken them through, so they could truly understand how this is not a single incident to be handled on a single basis. We have to, in order to bring about change, to develop a infrastructure that will address the ongoing incidents, so they will not continue to happen.
That's real good, Mama Campbell. That's real good. I mean, and that's the reality, because you won't see it through the lens unless it's through the lens of a lived experience. And I think part of what you highlighted in the gaps around the history and how long it's been and how close it is to the future. You were born in Mississippi, same county as Emmett Till. I'm only one generation removed from segregation. This is not, and I'm in my mid-30s. This is not something that is something of the past. This is something that we continue to wrestle with, and just shows up differently. So thank you for that journey.
Thank you.
So to recenter people back to what we're discussing, Greg, how would you explain systematic racism to someone who looks at racism through the lens of isolated incidents?
Well, let me first start by saying thank you to each of you who made this happen. I'm really excited to be here and excited to be amongst really some powerful people in the movement. And let me say for the record that I do work for Young Invicibles, and I'm always toot that horn, but my opinions and what I say do not in any way reflect Young Invicibles as an organization. But if you are interested, visit us at younginvincibles.org or across any of our social media platforms at Young Invicibles. I think you'll be greatly pleased with the work that we do on a daily basis. I cannot say it like Mama Campbell can say it. I wish I could. I wish I had the voice, but I can't. I think if I would explain it, I think isolated incidents. So in organizing, right, we use this term, the iceberg effect, right? What you see above the water in iceberg formation is not the entire iceberg. There's stuff beneath the water. There is things forming beneath the water that ultimately allows for that peak to surface. I've also heard it explained as a tree, right? That we see the leaves, but we don't see the roots. And so I would take that angle and explain to these isolated incidents, that every isolated incident is connected to something simmering below, beneath the surface that we can't see, right? That's the system, right? So we talk about police brutality, and even I think in the context of connecting, these race issues to as a public health issue, that we look at like things like police brutality, that on the surface we see, for example, I heard Mom Campbell talk about the execution of George Floyd. Well, there is years of believing that Black men or Black people are inherently dangerous, inherently more stronger, or whatever the case may be. And so there is a requirement for heavier force when dealing with them, right? We talk about all of these different issues. When you talk about the way in which COVID-19 affected, for example, our community, where all these underlying issues of cancers and diabetes and all these different things that result in food deserts in our communities, right? And chemical plants being built up in our neighborhoods. All of these things, we see these isolated incidents or consequences, but they are so much more connected to things that we don't see. And what we do, and I think the reason we have so many isolated incidents is because we spend a lot of time talking about this one issue, but we don't spend no time talking about what's beneath the surface. Yeah. And as much as I will shout George Floyd and Breonna Taylor from the top of the lung, at the end of the day, what we need to discuss is the policing system in America and how it affects Black people in America, right? Where police are called to protect and serve, but in reality, they scare and over police. And so all of these different issues, every incident, every isolated issue, every isolated incident is most certainly connected to some systemic issue that's just simmering beneath the surface.
Absolutely, Greg. And I mean, like, indirectly, you covered a multitude of systems, from the environment, where we wrestle with environmental racism, from criminal justice, which reigns at the time of policing, of sentencing and mass incarceration, and wrestling with proving that you're innocent when you've already been incarcerated, to re-entry from the criminal justice system to these other systems that we are going to talk about around education and health. Each one of these things we have to look at as a system. And a lot of times I think when we hear systematic racism, we don't connect to the fact that we sit in systems every day. So when people wrestle with, well, what can I do? You look at your systems you're sitting with every day, right? So that's, trying to capture the reality of why this term systematic racism really exists. The stressors of systematic racism are often compounded by the stressors of African Americans who have other marginalized identities, from gender and faith and sexual orientation and gender identity. Does anyone on the panel want to chime in about how intersectionality impacts African Americans' health and lived experiences?
I'll chime in, Chardee. Hello, everyone. Good afternoon. Thank you so much for organizing this event as well. I appreciate the invitation. So when I think about this question, I immediately think about the identities that I possess as a Black woman. And Dr. Carter has already kind of mentioned about the strength, of Black people and what the perceived strength of Black people, and that narrative around strong Black woman, that narrative is a narrative that I have always, I've worn it with pride. But here recently, I'm really understanding that another side of it, where it feels like it's more harmful, is causing more harm than good. In fact, I feel like it endangers us to an extent, because I recall the experiences of so many different Black women, many of my friends who have gone to the doctor and tried to advocate for themselves and talked about some of their experiences, and doctors not really being willing to listen to them or really take them seriously. And I recall the experiences of most recently during the pandemic, Dr. Susan Moore, who was a medical doctor herself by trade. And she ended up getting COVID. And I believe it was in November of 2020. So right there at the start of COVID. She got COVID, was admitted into the hospital, had complications from COVID-19. And as she lay in her hospital bed, she would advocate to her doctor and let the doctor know what her experience was, the pain that she was feeling. She had shortness of breath. And that doctor was reluctant. She stated the doctor was reluctant to give her any further pain medication, narcotic medication. And so after a few days, she was actually discharged from the hospital. The doctor discharged her and for her to go home and recover from home. And just a few short days later, she passed away. She was gone. And it was helpful to have her videos where she was providing that narrative of what her experience had been like. And I feel like the story just goes to show that as Black people with intersecting identities, no matter the amount of education we have, no matter the amount of money that we have, it does not prevent us from mistreatment in the healthcare system, in hospitals and board meetings, on the football field, the basketball court, or anywhere else. And this is just one of many experiences that Black women in these institutions face, where they have to advocate for themselves. So I think it presents a critical need for medical providers to really trust Black women and try to understand our pain when we experience it. Our concerns are real and they're valid, and the perception of our strength does not discount what we are due, which is thorough, culturally responsive medical care.
If I could chime in on this, and I really think that was so good. And I want to take a mental health angle, because I think even as Black people, I think we grew up in this narrative that, we got to work twice as hard to be just as good, that kind of thing, right? We've heard it, we've talked about it, and I think there's truth to that. But I also think that leads to this incessant need to be perfect. This almost toxic a need to overwork and to prove oneself. And I think that that really does increase the mental health issues within our community. I think we are resilient, but we are no more resilient than anybody else. I think that we are hard workers, but we have a boundary just like everybody else. I think that we can just about outdo anybody, but we also have our own limits. And I think that when we grow up in this context of be better, be good, be great, be awesome, and then be more than that, because everybody ain't gonna look at you, I think that just creates such a mental fatigue on individuals just trying to make it. And so while I think that conversation is important and there's truth to it, I think that we may need to start approaching that with a little bit more grace, a little bit more patience, and a little more humanity. That just because we all that in a bag of chips don't mean we aren't human, and we have to be human before we can be anything.
Thank you so much. Oh, go ahead, Dr. Carter.
If I can jump in on the mental health aspect, I'm from another generation. And so born in the 1950s, Mama Campbell, we can probably relate to some of these things, but imagine going to school and your box of crayons has something called flesh color, but doesn't look like you. Or your Band-Aids are flesh colored, but doesn't look like you. You try to put some pantyhose on, they look like gray. Imagine every magazine, with the exception of Jet and Ebony, has a blonde woman on the back who's a Brett girl and the hair's bouncing and behaving. All of these things going into your psyche. I was so glad as a child when James Brown came out with Say It Loud, I'm Black and I'm Proud. That's my theme song. And we came out with things like Black is Beautiful. Because imagine the psychological warfare you're going through back in the day. You're not good enough. You don't look like us. Your hair should bounce if you want to be a cheerleader. So many little digs that break away to make that child feel like I'll never be as good. I was grateful my parents believed in Blackness. Our oral history was passed down, our relationship with Native Americans. And yes, my mother had every Jet, every Ebony, everything Black you could think of. And we were constantly told, we are just as good as anybody else. That's still going on today, although it's a little bit different. We now have Band-Aids that have different hues. We now have an expanded Crayola selection. But if we don't invest in our children growing up to feel they are just as good, we'll have the same problems. We have the problem with our little boys and girls being diagnosed with attention deficit disorder because they may not be paying attention to a teacher who is not cross-culturally trained. So we have to invest in parents raising their children to let them know they have everything essentially within them to be successful. So I just want to, hang on to that mental health piece as far as systemic racism.
Thank you so much, Dr. Holliman Douglas, Greg, and Dr. Carter. Dr. Carter, I think you gave me the ally hoop for the next question around systematic racism in the context of education. As said before, education is often referred to as a system. So let's look at this and break it down from K through 12 all the way through college. So Mama Campbell, what have you seen in your activism for equitable delivery of K through 12 education through the lens of what you've been addressing around systematic racism that we should be paying attention to?
Well, from my experience, I have fought to derail the school to prison pipeline. I tell you, we're in a psychological warfare, and it hasn't been identified as that, but that's exactly where it is, what it is. As you said earlier, Chardee calling a thing, that's what it is. Now, when our children are behaving as children, they're not given the same consideration as their white counterparts. They're treated as aggressive and given punishment that's comfortable to criminal offense when it's just a school infraction. Now, so when you're looking at that and you're talking about the school to prison pipeline, you're looking at the system that feeds off a system. You got the criminal justice system that's feeding off the educational system, identifying the jail cells needed to be built based on the number of students who can't read or write at the 3rd grade level. So it's all connected. And as Dr. Carter was saying, in terms of making feel as though you're less, you're being taught not your full contributions as a people. So you're looked at as being second-class citizens who haven't contributed as much as others. And you're feeling the heat from that and always being defensive because you have to defend who you are. And as Greg said, keep trying and trying. There's a psychological warfare of being better and doing more. That is fatigue. It's fatigue mentally. So our children are looking and being targeted and profiled from an early age. If you tell a person that they're a cat long enough, they begin to think that they're a cat. If you tell children they are less than, you're teaching them that others' contributions are more than what your people have contributed. That's psychological warfare, when in their mind, they're made to believe that they're less than and cannot compete in society. Now we're getting into the theme of CRT, critical race theory, and opponents who don't want the truth to be taught in our public schools. And really, critical race theory wasn't being taught in public education at the lower levels in pre-K and 12 anyway. But because opponents running scared and not wanting the truth to be told because it's psychological warfare and brainwashing our children, and so that they can't compete because mentally they've been held back, and so they got a mental ban on their own mind in terms of what they can achieve. That's when you see, even in this day and time, with Dr. Carter being the first this, the first that, is this ridiculous for 2022 that we're still having Kamala Harris the first? I mean, this is really absurd. And that's what critical race theory opponents don't want the truth to get into our children minds, the truth where they can think through and know what they are capable of. And it is also, which they don't realize, warfare upon all of our children, because when you don't see each other as in a mutual respect, then you can never thrive as a nation, because that's what we are, a nation of people. And when you don't see your whole nation contributing, you see them as feeding off of you, you become feeling as though you are in a position of superiority. And that's how racism is not only taught in school, but it is taught by example.
Thank you, Mama Campbell. I mean, it's real as that is hitting hitting you as soon as you send your child a pre-K, and how they're predicting how many prisons are needed based on how many third graders fell, in addition to what's going on around the truth being taught around history. Looking ahead in the educational system, Dr. Holliman Douglas, knowing the deep impact of systematic racism, in your opinion, how should higher education be responding to serve African-American college students better?
Well, so I want to answer that question, but I'm really still on Mama Campbell because you made me think about how if we don't instill a different way of thinking about our kids from a very young age, so that they can grow up and be strong and confident in who they are, that turns into imposter syndrome as adults. And that's why we see so many Black people who struggle with it as adults in different settings. So I just wanted to put that out there, that it really does start young. So thank you for sharing that. And so for the question that you asked me, in terms of higher education, you all have been saying it over and over and over again. The first thing I wrote down was acknowledgement. And that is where we, and I say we, I'll say white leaders, white executive leaders, white faculty, white staff, they struggle when it comes to just acknowledging that racism truly is a thing. And like you said, naming it, we've got to be able to name it. But instead of actually naming a thing, we spend all this time going in circles every other year. It's a different word we're saying, it's a different trend. You know, we start with diversity and that's cute for a little while, and then we push back, and then we move to inclusion and that feels real fuzzy, and then we push back, and then we move to belonging, you know, and each one of those are real things, you know, that we should be embracing and moving forward. But when it comes to this system that we're living within, that we're having to operate within, that our students are having to learn within, that's racism, and it's systematic, and we have to really be able to name it. So I think just more education for our leaders about what racism is and how it shows up as a system. So that's one thing. The next thing I'll say is stop looking for a magic bullet. As leaders, you know, I've worked at so many different institutions where students will prepare a long list of demands, but I'll call them challenges that they want the institution to work on. And leaders will look for the easiest thing to do, the lowest hanging fruit that they can, you know, push forward and say, we did this, what you think about this? Or I've also had a president who came to me one time and he said, Chastity, we have a whole list of these things that students are needing. What would you say is the one thing we could do to make things, you know, better for everybody? And my answer is there is no one thing, because there's no one thing that put us here. We are in a system that interacts with so many different parts of who we are and what our experiences are like. So you quit looking for a magic bullet, basically. You have to be able to interact with our policies, our procedures, our funding, who gets what, lack of representation, and how are we handling bias incidents when they do occur with our students on campuses. So it's the hard stuff that we have to be able to address with urgency and great intentionality, as we've been talking about during this, and a sense of boldness. There was one institution I worked at, and I hope you don't go back and look at my resume, but I can remember it was a beautiful sight to see Black students. We had Native students and Hispanic students. They joined forces and they brought forth their demands together. They had their whole list, but there were a lot of intersecting demands. But I remember as we were going out to meet with the students, the president was running out the back door. No. There needs to be a sense of boldness when we are approaching students and working with them, and don't just wait for them to come to us. Let's have some ongoing meetings with students to find out, how are your experiences? And it shouldn't just be the senior leaders. It should be everyone, you know, for each department, talking to students about their experiences. And I'll also just say real quickly is that much of what our Black students go through, guess who else goes through it? our Black faculty, our Black staff. We're being pulled in so many different directions. Black faculty, they can't even get their work done because they're being asked to mentor different groups of students. They're being asked to do much more than what their white colleagues are being asked for. And many of them, they take pride in it, which we all do, but it's still taxation. It's still more taxing on all of us. So as we're addressing the needs of our Black students, we have to address Black faculty and staff and really all people of color at the institution.
Yes, ma'am. All right. And amen, as someone who works in higher education. And I want to just reiterate 3 things that you said: boldness, urgency, and intentionality. Drop the mic right there. Okay. Stop. Thank you both, Mama Campbell and Dr. Holliman Douglas, for tackling education. We've kind of already talked about criminal justice, but to specifically focus on why should the criminal justice system be looked at as a systematic stressor affecting African Americans' health. Dr. Carter, and for those who may be joining later, Dr. Carter, as a medical examiner, handles the autopsies for a lot of these cases, including a very high profile one here in Texas, Sandra Bland. So Dr. Carter, from your lens, how should we be looking at criminal justice as a systematic stressor for African Americans' health?
Racism abounds everywhere. It is definitely making our justice system imbalanced, and it has been. Just starting off, imagine how you feel. You're in prison for possession of marijuana since 1985. And now all these states are selling it to stock up on their coffers of tax money. They're selling it, it's legalized. The imbalance is just horrific. I attended a conference in 1994 in Los Angeles about the inequality of justice while you're charging Black people with possession of crack cocaine 10 times more than white people in possession of crystalline cocaine. And I said, guess what, folks? If you drink water and chew on ice, it's the same thing. It's the same thing with crack cocaine. But yet there's been a different charge. Even when President Obama tried to lessen that, he wasn't permitted to because of the way the Congress and Senate was organized. So we still have people in prison all of these years where now you have people selling that and making a profit off of it. We need to look at the racism. We talked about, Mama Campbell talked about the school pipeline to prison. It is very real. We are having our children criminalized as adolescents versus understanding and communicating and building them up. We have our tests, our SATs, all of these tests that are written in a way that can almost be failure if we don't teach our children how to take these tests.
Yes,
we are lacking mentorship in all areas of job performance. Whether you're a doctor, a lawyer, a barber, we need to educate our children as to what they can do and where their strength comes from. We also need people of color to be on the jury, because when I go to testify and someone's being charged with capital punishment or some other homicide charge, and I look in the jury and I don't see their peers. So we are failing when we say, oh, that judge was horrible. Well, you could have been on that jury too. So we have some responsibility to invest and also to make sure that our overpopulated prison system, one of the highest in the world, because it's now money making. You talked about the number of jail cells being constructed, the business behind that, the uniforms being made, the food service, the insulation, the windows, the doors, all that concrete. It's a huge industry. And we pay more to keep people in prison than to educate them, train them, support them, and give them physical and mental health. So The imbalance is great. And where do we stop it? There's not one silver bullet, as the doctor just said. But we as a community have to stand up and say, racism is everywhere. Open your eyes. And we have to start from that point.
Thank you, Dr. Carter. Your sister over here is itching to chime in, Mama Campbell.
Well, I can't, the panelists have been so profound. Dr. Carter, Dr. Chassity, and and Greg, you guys have all been on point. So I'm just gonna add in, you're talking about mental stress, which Dr. Carter has outlined. Mental stress, what it manifests into your physical health. We are more inclined to have diabetes, high blood pressure, mental illness, and all of the. How do you think this manifested? Where did it start? All these mental stressors. So when you're looking at mental stressors, you're looking at physical health. You're looking at premature death. So that's all I got to say. That is everything in a nutshell in terms of what everybody else has already emphasized.
Thank you so much, Mama Campbell. And in preparing for this event, the thing that really stood out the most that I was hoping it got touched on, and you pretty much touched on it, was the narrative around quote unquote diabetes, hypertension. African Americans don't have diabetes or hypertension because they're Black. They have it because of systematic stressors that are affecting their physical health. The narrative around the data as a predictor is problematic. It's blaming the victim and not the system. So it's really important for us and that's a lot of the focus around public health as, racism as a public health crisis, is we have to sit with how systematic racism creates the stressors that create the health outcomes. So thank you for touching on that. Greg, did you want to chime in on the criminal justice system?
Yeah, I think, and I don't know if I'm taking this the right angle, but I think even the criminal justice system that we have in America creates a story or an image for how Black people are perceived here in the United States, which certainly causes stressors to certainly to our safety, but to our health as well. That people who think they know something really like to throw out certain statistics. Black people are got this percentage of incarceration because of this amount of violent crimes, and they create this storyline, and then they use this story and put a blanket over all Black people. And so our very existence puts us in danger because of this perceived threat that we pose to I almost said the empire, but I want to be careful not to get anybody in trouble, to the country, right? And so I think that having that, and I hope I'm not being redundant, and I probably should have just said ditto after Mama Campbell and Dr. Carter, but having that kind of target daily and not being able to do anything with it, right? You can't change your hair enough. You can't study enough. You can't speak well enough. You can't pay it your way out of it. To literally have this target on your back day in and day out from birth to death is just incredibly stressful. And I think it adds to, like you said, Chardee, these issues that they label as Black issues, but are really a result of this very stressful life that we have no other choice but to live. Yeah, unless we reimagine what life in America looks like for Black people, but that's a different conversation for a different time.
Well, I think it's a segue right into what I wanted to close out with is, you know, we certainly, there isn't a silver bullet for solving systematic racism, but to kind of look at solutions, how can declarations of systematic racism as a public health threat result in real action to address systematic racism? And I guess this will kind of close us out, and we'll go to each panelist to kind of give a quick response so we have enough time for Q&A. So I think the one, Dr. Holliman Douglas, how can declarations of systematic racism as a public health threat result in real action to address systematic racism?
Yeah, so I think, yes, declarations can help. And I hope that declarations continue, but they can't help alone. They have to be accompanied with policy changes, you know, reviewing our policies, seeing how different groups are impacted based on these policies. New laws need to be created that scrutinize bias incidents and biased care that we receive. Greater accountability and connect that to funding, federal funding for organizations. For those who are doing an exceptional job with serving the needs of Black people and other people of color and other marginalized groups, then there should be some type of, and I'm just thinking hypothetically, maybe some type of performance funding that, you know, that feeds, that provides them to be able to keep doing that type of work and be a model for other organizations. And what else did I say? And then also, but I think there also needs to be greater accountability. And so we need to require that organizations, if they don't know how to better serve Black people, then bring in consultants, provide some funding so that they can be able to do that. But it can no longer be just a happenstance. It needs to be very strategic, very systematic, and it needs to flow to all organizations, especially the ones making these declarations.
Thank you, Dr. Holliman Douglas. Dr. Carter?
I have a few words to add. Documentation, education, accountability, and mentorship.
All right, mic drop. Okay. She said she had a few words. She was serious. Greg, and if I can recenter people on a question, how can declarations of systematic racism as a public health threat result in real action to address systematic racism?
I will be honest to say I don't really know how to answer that because I tend to, and I hope I'm not looking from a pessimistic standpoint, but I think that even declarations can be more performative than transformative. And so I think I agree with the Dr. Holliman Douglas that it's not enough. But I think I want to point the second question of how can the public help move the needle from declaration to action. And I think that's certainly the work that I do, right? And I think what Dr. Carter mentioned about like education and it starts with, I think, us doing the work to educate our community on, you know, what, how does race play in on our public health, but also this grassroots organizing work to ensure that we hold people accountable, again, hitting on that word of accountability that Dr. Carter threw out so brilliantly, of ensuring that the individuals that we elect, the individuals, there is an election going on, so go vote, that the people that we elect, that the people we call to represent us are doing it adequately, despite our skin color, despite our demographic, socioeconomic status, and all that, all of the above. And so certainly just doing the work and stand on the ground to ensure that people hear us, see us, and represent us appropriately.
Thank you so much, Greg. To close this out, Mama Campbell.
Well, thank you, my darling. And I greatly appreciate everything everyone has already said. Now, when you're looking at declarations, it's just as Alcohol Anonymous. The first order of business is admitting that there's an issue. So that's where a declaration comes in. Then you have accountability. holding our leaders accountable. Then you have, first of all, the infrastructure that needs to be put into place to help those who are going through the systematic racism. What are you doing to help and to resolve the issue? That's where you're going to move the needle and bring about real change, is to bring the infrastructures in place to hold those accountable who are not doing the things that they say they are doing that need to be done. Thank you.
Thank you, thank you, thank you. It's Black History Month, and it's part of our culture of call and response, but we're virtual. So if you have learned anything new, if you have unlearned anything, if you just want to say amen or thank you for what's imparted, you can do the reaction emoji with a hand clap. You can drop something in the chat. I dropped in the chat that we can have a couple minutes of a Q&A if any questions come through. But as we wait for anything to come through the chat, I just would like to thank our panel for giving so freely and authentically of their insights and their lived experiences. Thank you, Greg, Dr. Holliman Douglas, Dr. Carter, and Mama Campbell. We have a question. It is from Patrick Nguyen. From a political standpoint, there seems to be a need, and I'm reading from another screen, so excuse me. There seems to be a need for bipartisanship for infrastructure, funding, policy, laws to change. What ways can we as individuals help with creating more bipartisanship and reach to other individuals to help? It's a great question.
Well, that's a great question. And as Dr. Martin Luther King said, you can legislate laws, but you can't legislate morals. There are a lot of laws on the book that we need to familiarize ourselves with, and making those laws work for us. And that is the key right now. We don't need any special sessions to come about with other laws, because the laws that are on the books are not being followed.
That part.
I'm so glad I'm not here in the capacity of engagement managing Invicibles because I know what I have to say. But I'm here as Greg, and Greg would say bipartisanship is I don't want to say nonsensical. I don't want to use that word, but I want to use it, and I want to say. Let me just say what I want to say, because I can't get the word I want to say. But I think we've given up a lot of opportunity and a lot of possibility by cowering to who we think hold the power, people who we think have this perceived power, right? And I think this idea of bipartisanship is cute until the people who hold the power in terms of partisanship aren't willing to move the needle in human and civil rights, right? And so I think that we can have conversation, and we can walk across the aisle, right? And we can do all these things, but at the end of the day, when life is on the line, we got to do what we got to do. And I'm afraid that bipartisanship and what's the word I'm looking for? This need to compromise really, at the end of the day, jeopardizes, if that's a word, our productivity and promotion as Black people in America. And so I think with the context of race, and I want to keep it there, that bipartisanship is really, really difficult when people don't even believe our existence matter. And so I would, as an organizer, as all that good stuff, would encourage us to stay on the necks, for lack of a better term, to present our demands as they are, and to work with whomever to get the job done.
Thank you. I'm checking the chat, checking the chat for additional questions. But you know, a lot of what you said, Greg, is this tension between current state limitations of having to work in the system of bipartisanship and what we would want to reimagine around being able to do what's right and check unchecked power, right? That is keeping its foot on the necks of marginalized communities. That's the difficulty of knowing that it feels like bipartisanship is our only option right now for simple things to move beyond second class citizenship. And to what Mama Campbell had emphasized, there are some laws that we're seeing that were needed, but not at a local. What we're wrestling with is a hyper local response. When you think about no knock warrants that are, there's now a call for because of what happened in these cases where they are breaking down doors and not even checking who is there, guns ablazing. But those are happening in different pockets. We need federal response to those types of things. But as African Americans, through that original bucket of civil rights legislation, have federal protection. A lot of this is just not being emphasized, is not being
Abided by.
Yeah, abided by, and used as a reason for why when these laws aren't followed, that there is a real response, that there is real punishment, that we are not holding our breaths after watching Black people be martyred and executed on live video and holding our breaths for conviction.
Right.
These laws already exist.
Right.
They are choosing which laws they want to uphold supremacy.
Right.
So a lot of this is accountability around laws on the books, although there are some that do need to be passed on a federal level. I took my moderator hat off and went to the panel for a second. Let me see if if there are any other questions that hopped in the chat. Okay, so why was our enrollment application for race identity changed over the years? I want to acknowledge that, you know, I don't know of any change, if I'm honest. So I wish that I don't have an answer. I don't know if it's changed, and I don't want to misrepresent what the institution has done. I'm thinking it is, but if you send me a private message on email, I can take this back. If Dominique, if you drop my email in the chat for her, Dominique or Ashley, and warrant some follow-up so I can check into what happened. All right, thank you, Dominique. Well, I'm not seeing any other questions on the chat. You know, we kind of broke our time contract and went a little past 1 o'clock. We thank you for rocking with us. We thank you for listening, and for the beautiful comments that are being dropped in the chat. And I'm just reading the comments, but I thank you. As a reminder, be sure to check your emails for emails from Student Life about the remaining Black History Month events. Be sure to check out that Black History video contest that will award the top 10 videos $100 of videos about why it is important to celebrate and commemorate Black History Month. Again, thank you to all of our panelists and Student Life. I think we can sign off. I kind of want to get a snapshot of this chat right now before you close it out, though. Oh, and also there will be a playback of this video posted to YouTube. So look out for that under the playlist that is under Student Life's channel. So thank you, everyone. And I think that closes us out unless Student Life has anything.
No, we don't. Thank you guys so much for being here. Again, just to reiterate about the contest, we definitely have the prizes available. We would love to hear from you as students. And we thank you for sticking with Student Life virtually on campus, hybrid model. So we truly appreciate you all supporting Student Life during Black History Month. So we still have more to come. As Chardee said, we have line dance class. So come on and join us virtually and get your boogie on tonight with us.